Good afternoon. Thank you for joining us today. Let me give you, as usual, today's statistics. The number of positive cases reported yesterday was 1,330. That represents 6.2 of the total number of tests carried out, and the number of confirmed cases in Scotland overall now stands at 175,332. 394 of today's new cases were in Greater Glasgow and Clyde, 245 in Lanarkshire and 135 in Lothian. The remaining cases are spread across 9 other health board areas. I can also tell you that by 8:30 this morning, 462,092 people had received their first dose of the COVID vaccine, and that includes 56% of over 80-year-olds living in the community. You will recall that already 95% of people in care homes, older adults in care homes, have also been vaccinated. In addition, I can report that 2,016 people are currently in hospital, which is 6 more than yesterday, and 145 people are in intensive care, which is 4 fewer than yesterday. I'm also very sorry to report that a further 92 deaths have been registered in the past 24 hours of patients who first tested positive over the previous 28 days. That means the total number of deaths under this daily measurement is now 5,888. However, National Records of Scotland has just published its weekly update, which you will recall includes cases where COVID is a suspected or a contributory cause of death, even if it hasn't been confirmed through a test. Today's update shows that by Sunday, the total number of registered deaths linked to COVID under that wider definition was 7,902. 448 of those deaths were registered in the past week, which is 75 more than in the previous week. 294 of the deaths last week occurred in hospitals, 111 of them occurred in care homes, 8 in a different institutional setting, and 35 deaths occurred at home or in another non-institutional setting. Now, that number I've just reported to you, 7,902, is a difficult one for any of us to grasp and to properly comprehend. And of course, yesterday, the death toll across the UK as a whole passed 100,000. Those numbers should make anyone in a position of authority, and I know they certainly make me, think very hard about what more we could have done and what lessons we must continue to learn. I know that I and everyone in my government have tried every day to do everything we possibly can, but I don't think any of us, reflecting on numbers like these, can conclude that we have always succeeded. And for any mistakes we have made, firstly, I take responsibility for that, and I am, and I always will be, truly sorry for any mistakes we have made or for any reflections that we could have done things differently. Now, I say every day that none of the people who have died are statistics. They are human beings who were loved and who right now are being mourned by friends and families. We should never ever forget that, but somehow it feels more important than ever today to remember that. Now, when the immediate crisis of the pandemic is over, I know that we will want to formally commemorate and remember those who have died. But I want today to take just a moment to pause and remember. So please join me for just a few seconds of reflection in memory of all those who have died in this pandemic so far and in sympathy with all those left behind. Thank you. To those of you who are grieving, I know that this won't be any consolation to you at all, but nevertheless, I do want you to know that your loss weighs heavily on me, and it always will. Now, there are 2 other points that I want to update on today. The first is that Public Health Scotland has published a report on shielding during the first wave of the pandemic. That report gives some detailed statistical information on issues such as whether the advice to shield was followed and what evidence there is that shielding was effective. It also provides details about the value and, in some areas, the shortcomings of the support offered to shielders during the first wave. It's important to remember, of course, that by the middle of February, in just a couple or just more than a couple of weeks' time, people who were on the shielding list and who are over 16 years of age will have received a first dose of the vaccine. Now, that will not guarantee anyone's safety for reasons we've set out before, but it will start to provide valuable protection after about 2 weeks of receiving the vaccine. So that will be taken into account in our future advice for shielders. In addition, the Scottish Government no longer issues guidance to people on the shielding list, which is quite as restrictive as it was in the first wave of the pandemic. This is in line with the recommendation in the report that we should not return to full shielding. Instead, we must help people who are shielding to make an informed choice about their actions. But today's report is a reminder, if any were needed, of the scale of the sacrifice that we asked from people who were shielding during those early months of the pandemic. Staying at home completely without going outside at all, even for exercise, was incredibly tough, I know, for people who were asked to do that. So I want to take the opportunity today to thank everyone who is on the shielding list for everything you have done over the past few months, not just to keep yourselves safe, but also to help us collectively in this fight against COVID. And I want to reassure you that you will continue to be central to our thinking and our decision making as we move through this next stage of the pandemic that we are living through. Now, the second point I want to cover today relates to travel, since there is a lot of speculation about a UK government announcement that will be made on this later today. So let me just reiterate some of the points that the Deputy First Minister made to Parliament yesterday that some of you may have heard. Travel restrictions will be vitally important in the coming months. Travel restrictions will be a key way in which we help to stop new cases and, in particular, new variants of this virus being imported into Scotland. As we found out and have learned to our cost over the summer, the virus travels when people travel, and there will be a need for restrictions on travel, perhaps even after vaccination is even more widespread than it is right now. Indeed, at a time when there is rightly a focus on lessons that we should be learning from earlier stages of the pandemic, this is one that I would highlight that we perhaps should have done more at an earlier stage to restrict travel across our borders. Now, we've been in discussion with the UK Government for some time about improving border controls. In these discussions, we have raised the issue of quarantine hotels, where people who are returning to the UK can self-isolate. The Scottish Government believes that a comprehensive system of supervised quarantine is required for this next stage of the pandemic as we suppress cases here to mitigate against the risk of new cases and new variants being imported into the country. Now, I've just taken part in a Four Nations call and I've been briefed on what the Prime Minister is likely to announce later on. I'm not going to preempt his announcement. It wouldn't be appropriate for me to do so, but clearly there is speculation in the newspapers. But I think I do have a duty at this point to say that I am concerned that the proposal does not go far enough, and I've made that point very strongly in the Four Nations discussions that we've just had today. So while the Scottish Government will initially emulate the UK Government's steps on enhancing quarantine arrangements, we will be seeking urgently to persuade them to go much further and indeed to move to a comprehensive system of supervised quarantine. Given the obvious practical issues involved, we are very clear that our preference is to have consistent quarantine rules across the UK. But if there is no agreement to go further on a Four Nations basis, we will be considering going further ourselves, and we will set out any such additional measures next week. I know that talk of travel restrictions is tough to hear for everybody, but particularly tough for many businesses. And so we're also asking the UK Government to work with us to provide additional support for the aviation sector, which of course is directly affected by further restrictions. Fundamentally, though, we believe that tougher travel restrictions, however unwelcome they are for all of us, are essential to managing the risk posed by new variants and by new cases coming into Scotland. And as I said, I think they will become increasingly important as case levels in Scotland, we hope, continue to fall. And that makes it all the more important that we do everything we can to protect against the risks of re-importation. Now, as I say, we are likely to set out further steps next week, but for now, let me reiterate that no one should be travelling overseas right now unless for absolutely essential purposes. And I'm afraid that means you should not, at this stage, be booking holidays overseas. I know that is hard to hear, but again, if I can be really frank with people, our best route back to greater domestic normality right now, as we continue with the vaccination programme, is firstly to suppress the virus here to as low a level as possible, again, as we did over the summer, then give ourselves the chance of better controlling it through test and protect, and next, doing much more than we did last year to protect our borders and stop the virus being imported. That is not easy for anybody to live with, but that is the recipe to get ourselves back within our own borders to being able to have more of a normal life, perhaps see more of our loved ones and, of course, get children back to school on a sustainable basis. For the moment, though, and this is my concluding point, the single most important thing that all of us need to do to curtail the spread of this virus is to stay at home, and that is and remains for now the very clear and overriding message. Please stay at home unless you have to be out for essential purposes like caring, essential shopping and essential exercise. If you're meeting somebody from another household outdoors, you should be in a group of no more than 2 from no more than 2 households. Please work from home if you possibly can. All of us have a duty to do that as far as we can, unless we have to be at work because that work can't be done at home. And that does apply even to those of us in government. I have to be in St Andrew's House to lead the response to this pandemic and to speak directly to you. But even me, when I do get the opportunity, I should work from home because everybody has to lead by example. And on any occasion where you do leave the house, please remember facts. Face coverings when you're doing essential shopping, for example. Avoid places that are crowded. If you go shopping for essential purposes and you find that it is busy, go somewhere else or go back later. Clean your hands regularly, clean surfaces, use 2 metres distancing if you are interacting outdoors with somebody from another household, and self-isolate and get tested if you have any of the symptoms of COVID. We are, as I said earlier in the week, seeing cautious signs for optimism right now in our case figures. We are starting to see even more cautious signs given the lag effect, but nevertheless some cautious signs for hope in our hospital and intensive care admissions. We are not yet seeing that, again, given the infectious path and the lag associated with this virus in the numbers of people dying. As we see today, the figure remains horribly high. But hopefully, if we can keep suppressing case numbers, we will also see that start to reduce in the weeks to come. But this takes a massive, ongoing collective effort involving each and every one of us. So thank you again, particularly this week when the UK has passed this horrible milestone. Thank you for everything that you have done, that you continue to do. Please stay at home, help us protect the NHS, and most importantly of all, help us to save lives. Thank you very much for listening today. I'm going to move now to questions. As usual, you will see that I'm joined by Jason Leitch today, who will help me with the answers to the questions. And the first question today comes from Ross Govins from STV.
Good afternoon, First Minister. The UK government's announced construction of a COVID-19 testing lab in Scotland is to be halted. Are we seeing a change in testing policy at the moment? And on quarantine, I appreciate the full details are still to emerge, but can you give an indication to people of how long these measures would have to be in place to be effective?
So on the reports about the UK government reassessing the need for what's been called the mega lab for testing in Scotland, we're continuing to engage with them. I think these questions probably have to be answered by them. There is no change in the Scottish Government's approach to testing. I'm not aware of any change in the UK Government's approach to testing, but from what I understand, they are assessing the need for the physical infrastructure that goes with that. But we'll be engaging with them on that in the no doubt the hours as well as the days ahead. On travel restrictions, I don't want to give arbitrary dates today that then, understandably, on the part of journalists, become headlines that people place a lot of store by, because none of us, and this is one of the hardest parts of standing here every day. Obviously, the hardest part is the reality that I'm reporting, but it is also difficult because I can't be definitive in response to some of these questions about, when will we see an end to whatever restriction it is that we're happening to be talking about. And that's true of travel restrictions as well. And don't take this as an indication of what might happen here, because none of us can see into the future with certainty. But I was reading yesterday of New Zealand saying that its travel restrictions are likely to be in place throughout much of, if not all of this year. This pandemic is not suddenly going to disappear. And remember, it is a global pandemic. So our priority right now has to be suppressing the virus to as low a level as we can. We know we can do that because we did it last year. And to get as close to elimination of it as we possibly can, which we did last summer. And this is what's different from last year, get the vaccination programme completed as quickly as possible so that we're building up that protection in the population as well. But what we also know from last summer is that it's not enough to do that within your own borders if you then enable the virus to come in from other countries. And that is a lesson we've got to learn from last year, and it is a lesson that it is even more important to learn given the emergence of new variants. This is a virus that is already mutating. So that makes it really important that as we suppress domestically, we effectively put a protective ring around our country in order to guard against it coming back in. And that suppression, vaccination and protection against importation, that is what will allow us, I hope, over this year to get some more domestic reality back, but that will be undermined if we have new variants coming in and seeding here and then transmitting here. How long will we be in that position? I can't answer that right now, but what I do know is if we get these ingredients right, then over the course of this year, we might not be able to go on holiday overseas. We might not be able to do everything that we all like doing. We might have to continue to socially distance and wear face coverings, but maybe we can get greater normality than we have just now. Certainly children back at school and maybe the chance for a bit more interaction with our loved ones. So if the price for that is not going on a foreign holiday, I'm not saying that's easy for people who enjoy that and who look forward to that, but maybe it is a price that we're all going to have to be prepared to pay, recognising, of course, that will necessitate support for the industry and the businesses that are very directly affected by that. Do you want to say more about travel restrictions, Jason?
I think you've covered it really comprehensively, First Minister. The difficulty in predicting a time is we don't know what's going to happen to the virus in our own country, never mind the whole world. There are travel restrictions for some diseases in the world just now. You can't travel to some countries without a yellow fever certificate. The world has responded to infectious disease before, and that's where we will move to. During and after this pandemic, the world will have to make some choices. Governments will make choices about what travel means. For now, the WHO say one of the key ingredients to get your pandemic under control is stop importation. It's pretty straightforward, the advice. It's very hard to implement, of course, as you've seen all over the world, and that's the advice we're giving the First Minister.
Peter McMahon from ITV.
Thank you very much, First Minister. First Minister, ITV Border today is looking, amongst other things, at the situation of parents who have to homeschool because the schools have obviously been shut. And we've spoken to Sarah Axford, who's the service manager for Children First in the Borders. Now, she highlights that one of the big issues is connectivity for some people, particularly in towns or villages, in rural communities where they don't have a very good connection. She says this, one of the other issues is around finances. So Wi-Fi is often an expensive commodity. So lots of families that we work with choose between a data plan for their mobile phones or Wi-Fi. So lots of families are coming to us and they're saying they are struggling. That's a direct quote from her. What more can you do to help families across rural Scotland, specifically in the south of Scotland, who are going to have to homeschool, it seems, for some time yet?
I think that's a really important and legitimate question. I will take away the specific comments in that question and talk to the Education Secretary about what more we can do. I think this is an issue that has relevance right across the country, but you're right to say particularly in parts of the south of Scotland and in parts of the Highlands and Islands of Scotland where connectivity is more challenging than it is in the Central Belt. We have already done a significant amount, and I think it's important to reflect that. We have, through funding that we have given directly and funding to local authorities and work that local authorities have done, we've managed to get devices and connections to thousands of families across the country who would otherwise have struggled. Just a couple of weeks ago, the Deputy First Minister announced additional funding for local authorities so that they could do more to help families with the challenges of homeschooling, so they have greater resources now to perhaps directly respond to a family that is in the position of choosing between a data plan and buying food. No family should be in that position, and therefore councils have some resource to help with that. But so important is this, and given the very stark comments that you've just recited to me there, I will, after this briefing, have a further discussion with the Deputy First Minister and with officials to see whether there is even more we can do to try to address some of that. Of course, not taken away from the importance of doing that, it would be remiss of me not to reiterate what a big priority it is for the Scottish Government, as quickly as it is safe and feasible to do so, to get children back into face-to-face learning in school. Now, it may not be the case that we can do that overnight for every young person. It may be that we have to do that on a phased way, prioritising certain cohorts and for some perhaps having even a period of blended learning. These are issues we are working through and considering right now. But it comes back, I suppose, and I'll end here, to something I said earlier on. We are, all of us, not going to be able to do everything we used to take for granted for some time to come yet. We are going to be in a position of having to make choices to open up as much normality for ourselves as we can. And if we are clear, and I'm crystal clear about this in my mind, that the top priority in restoring normality is for young people, back to school and back to them being able to interact with their friends as much as possible. So if that means I can't go overseas, or you adults watching can't go overseas for a bit longer, if we can't go to the pub or to restaurants the way we did without thinking about it before the pandemic, these are the prices I think we have to be prepared to make to get children back to school. Now, hopefully, before too much longer, we can do many more of these things, and these trade-offs won't be quite as stark as they feel right now. But getting young people back to greater normality, I think, has to be a driving priority for all of us, and it's certainly a driving priority for me and the government. Lisa Summers from the BBC.
First Minister, I wondered how much further you can go than the UK government in limiting travel here in order to try to suppress the virus as much as possible. And given testing is a huge part of controlling the epidemic, were you involved in the UK government's decision to halt the mega lab that was due to be constructed in Scotland? And just a word on vaccines as well. Are you completely confident that health boards using mass vaccination centres are the right way to kind of meet those targets, given some GPs in some parts of the country are expressing frustration that they're not actually involved in running the programme for the over 70s?
Let me take that. I don't at the moment have all of the details around the decision the UK government's taken to pause construction on the mega lab. And as I get more of that detail, I'm happy to share more of it. It is a UK government decision, but the extent to which they have shared that with us and the fine detail of the reasons underpinning it, I'm not able to go into any more detail than I have with you right now. In terms of the practicalities of the Scottish Government going further on supervised quarantine, this is with people who come back to or into the country having to quarantine in a hotel for their period of self-isolation. There are practical difficulties which don't take very long to work out if Scotland was to do that differently to the rest of the UK. For example, people travelling into Scotland will come in often through a hub, an aviation hub, Heathrow Airport, for example, elsewhere in the UK. So I think it works better if we have common arrangements across the UK, and I hope we can get to that. But nevertheless, I've got to be very clear that the Scottish Government, learning the lessons of past phases of this pandemic, is doing everything we think is necessary as well as we possibly can. And my starting point on this right now is that we need a comprehensive system of supervised quarantine. So we're saying to people, don't travel at all unless it is essential. And there are some countries, because of the South African, Brazil variants, where we have banned travel completely. But there may be UK citizens coming home. So I think we should be as comprehensive as possible. Anybody who is travelling and is coming from another country here, I think full and comprehensive cover for that supervised quarantine is essential. I don't want to preempt what the Prime Minister is going to say, but if you take some of the speculation that's been in the papers, if you impose that purely for the countries where there is a travel ban in place, the very fact that there is already a travel ban in place tells you you're going to be reaching very, very small numbers of people, because nobody should be travelling from these countries, even for essential purposes, already. And if you focus just on countries where a variant has been identified, South Africa, or countries where it is known to have been identified, then you possibly miss countries where it has already travelled to but hasn't yet been identified. So the South African variant could come into the UK from countries where we didn't know that it had been identified. So when you're trying to stop a virus getting into the country, and particular stop new variants getting into the country, you really have to have as comprehensive a protective ring as possible, because the virus will find the holes in the net and it will get through the holes in the net. So these are discussions we will continue to have with the UK government. I've indicated I want to discuss this further. There's another Four Nations discussion later today, which is a scheduled weekly one, and we will try to encourage a Four Nations approach that goes much further than what I understand the Prime Minister will set out today. If we can't reach that, or we can't reach that quickly enough, we will consider what it is practical for us to do ourselves, and we'll set that out in the coming days. And you asked me vaccination centres. I'll hand over to Jason on this. So we have a mixed system where in some health boards GPs will be vaccinating in the over 70s group, but many of them will be done through vaccination centres. This is about health boards coming to the best arrangement to do this as quickly as possible. Lots of people I know got letters yesterday, my own father amongst them, with a vaccination appointment for next week at a vaccination centre, people in the over 70 group. This is about getting through these groups as quickly as possible and finding the best ways to do that. And health boards, remember, have experience of vaccinating against flu every year. GPs have a big role to play and are playing a fantastic role right now in vaccinating the over 80s. But this is about getting through this as quickly as we can. I don't know if you want to add.
So one really brief thing on travel. The reason we know about the new variants in Brazil and South Africa is because they had massive increases in prevalence. Then they did the genomics. The UK has an almost unique approach to genomics, because we can do 10% of our cases genetically. Most countries can't do any, and some can do very few. Once your prevalence is up, it's too late. It has spread, and it has probably travelled. So that's one of the reasons why thinking about travel from all over the world, whichever country you are, also stopping the UK variant spreading to European countries, is really important to your response, whoever you happen to be. Secondly, on the vaccination programme, one size does not fit all. If we got the GP practices to do all of the vaccination programme, I'm afraid they would have to stop doing routine care. And if we did mass vaccination everywhere, we would lose some of that person-centred for the over 80s, for perhaps those who are more vulnerable, perhaps those who need home visits. So that's why it's a blended approach, adapted for the region or the rurality or urban setting you happen to be in.
Alan Smith from Bauer.
Thank you, First Minister. Just on the issue, the Deputy First Minister yesterday did indicate that you would go further than the UK government if the restrictions on quarantine were at what he called a minimal level. Given the concerns you've been talking about this afternoon. I was just wondering, what's being proposed, does it even meet what you would consider to be a minimal level? And on that Four Nations call you had this morning, was there any discussions at all about, Boris Johnson's expected visit to Scotland this week? And just a question for Jason Leitch as well. Are you seeing any new trends in hospital admissions that we didn't see during the first week? We've been hearing a bit about hospitals seeing more younger patients this time around that they didn't see in the first wave. Is that reflected in any of the data you have at all?
I'll hand over to Jason in a second. I'm trying here not to preempt the Prime Minister's announcement, but there has been a lot of speculation in the media, which I think is probably in the right ballpark. I would describe what I think he's going to announce today as minimal on this front. It's probably the least that could be done on the issue of supervised quarantine. And let me be clear, I welcome it as far as it goes. I think it's important in and of itself, but I don't think it goes far enough for the reasons that I've set out. It would leave far too many weak points and gaps in that. If you think of it as a protective ring around the country, it would just leave far too many points of entry for the virus still to get round it. So I hope we can persuade the UK government to go further. Certainly they haven't shut their minds or their door to that discussion. And because for the reasons I've also set out, I think it would be better to do it. England, Wales and in Scotland, we are an island. It would make most sense to do that in a combined, aligned way. But if we cannot, for whatever reason, and we respect each other's decisions on these things, get to that point of agreement, then it will be incumbent on me. If I'm standing here telling you, looking down this camera as frankly as I can and saying my assessment that one of the things we maybe didn't get as right as we should have done last year was around border control, I can't say that to you on one hand and then just shrug my shoulders and say, well, because I can't persuade Boris Johnson, I'm not going to do more here now. So that's the position, but we'll keep talking, of course. On the issue of the Prime Minister's visit, I understand tomorrow, well, firstly, no, it wasn't discussed on the Four Nations call. Can I preface what I'm about to say here by being very clear about what I'm not saying, because I know that when I speak about things like this, the headlines often, and again, let me just say, I'm not criticising the headline writers, it's sometimes these things too easily translate into headlines that don't really get what I mean. I am not, and never would be saying that Boris Johnson is not welcome in Scotland. He's the Prime Minister of the UK. But beyond that, everybody's welcome in Scotland. Well, maybe not a certain ex-president that I kind of suggested earlier on, maybe rather didn't come to Scotland, but I won't divert down that road. Boris Johnson is not unwelcome in Scotland, even if I had the ability to stop him. So that's not what this is about. And I'd be really disappointed if that's how what I'm about to say is translated. But we are living in a global pandemic. And every day right now, I stand, look down the camera and say what I'm about to say. Boris Johnson does that. I heard him do it as recently as yesterday. Don't travel unless it is really essential. Work from home if you possibly can. And that has to apply to all of us. Now, people like me and Boris Johnson have to be in work for reasons that I think most people understand. But we don't have to travel across the UK as part of that. Is that really essential right now? Because we have a duty to lead by example. And if we are going to suggest that we don't take these rules as seriously as we should, it gets harder to convince other people. So that's why I perhaps am not ecstatic about the thought of the Prime Minister visiting. It's not because he's not welcome. In fact, if I was standing here being political, you could perhaps conclude that I would be quite welcoming of him coming to Scotland. But we're in a global pandemic. Let's all remember the importance of these rules and the importance of us. None of us are infallible, as I've demonstrated, but we've all got a duty to lead by example here.
So the fundamental answer to your question, Alan, is yes, the second wave is younger. Forgive the slightly impersonal nature of how I say that. Certainly for positive cases, admissions and ICU admissions. Unfortunately, the death rate and the mortality is still mainly old. So we are seeing younger people catching the virus or older people being more protected by their own behaviour. I think it's probably more that. We know that the virus itself is behaving the same. It's more transmissible, but not more likely to transmit to younger people. So you don't need to worry. You have to behave in the same way. But we think probably, and the history of this will not be written yet, the data not fully analysed, we think those who are a bit older have begun to protect themselves more thoroughly into this second wave. And remember, in the beginning of the second wave, we had universities and colleges and schools open, which we didn't have in the first wave. The other trend, I'm pleased to say, is that in recent days we've seen both inpatients and ICU admissions begin to fall. So prevalence has fallen a little over the last few weeks. Then the next indicator would be ICU admissions, inpatient admissions, then ICU admissions, and they've both fallen in the last 7 days. They're still way too high, but they're beginning to fall.
Bobby Donald from Global.
Thanks, First Minister. Just one on the vaccination programme. We've heard claims from a number of health and social care workers who weren't asked to provide identification or their letter when they turned up for their jab. Are you aware of any security concerns? And I imagine any cases of vaccine fraud would be rare, but what procedures are in place to stop people jumping the queue when letters are sent out on a wider basis?
I am not aware of any significant concerns about fraud, and I think you're right. I think that would be rare. Obviously, health boards have an estimate of the eligible population for that priority group, because it is frontline patient-facing in the main health and care workers, and they will have their own ways of checking, through the booking system for vaccination, whether people are genuinely employed. I'll perhaps try and get you a bit more of a detailed explanation of exactly what that system is, unless Jason can give it just now, which is shaking his head. But I don't expect this will be a significant issue, but if you've had concerns raised from health and care workers, then obviously that's something we would want to take the opportunity to look into. I have Craig Payton from PA.
First Minister, just to take off on the Prime Minister's visit tomorrow, do you believe that this would constitute a break in COVID rules? And if you had been consulted beforehand, would you have told him maybe it's better just to stay in London? And just on the rumoured quarantine hotels policy, how would it work in practice? And have you had any discussions with the hotel sector? Because I'm just thinking of hotel staff members who may have been furloughed, who are thinking maybe I'm going back to work, and maybe there's a bit of a panic there. How far have you got in the planning of this?
That's underway, and so the questions you're raising there are exactly the kind of details we are working through right now. And when we set out our own plans on this, we will set out the detail of that. I understand that when the Prime Minister sets out his intentions later on, there will also be an acceptance that there are still some details of that to be worked through. But these are all legitimate questions that we are working through. Look, I don't want to go much further than I have on Boris Johnson's visit to Scotland tomorrow. And can I say, first of all, that I don't think this is because he's visiting Scotland. I think it is just about what all of us have to think about when we're travelling anywhere right now. So what I'm about to say, I guess, would be applicable to somebody like him travelling within England, or me travelling within Scotland right now. I'm sure he and his advisors will take great care to make sure he's not breaking any laws. I take that as read. But we all have to make judgments on what we genuinely think is essential right now. And I think that applies not just to cross-border travel, but to travel within our respective countries. I mean, I'll illustrate this with a discussion I was having with my own team earlier on of a suggestion that I might next week go to visit one of the newly on-stream mass vaccination centres to see how it's operating. Now, I would really like to do that because it would allow me to thank the staff that are working there. It would allow me to see for myself what the arrangements are. But I've got to ask myself, is that genuinely essential for me to do right now? And if it's not, then possibly I shouldn't. Maybe I should have a Zoom call with some of the staff to thank them instead. I make a judgment every day. It's essential for me to come into St Andrew's House because I think as First Minister I need to be leading this response on site as far as possible, and I can't do this daily briefing unless I'm standing here in front of the camera. But other things are not essential. And if I'm standing here every day saying to all of you watching, don't leave your house unless it is essential. I've got a duty to subject myself to that same discipline and decision making. Now, I will have to be out of my home perhaps more often than some others do for the reasons I've set out, but I still shouldn't be able to just go and do whatever I think I might like to do. So I suppose that's the context here. And this has been asked of me in the context of a Boris Johnson visit, but I would apply it to myself in the decisions I'm making right now. We, all of us as leaders, we're asking all of you to do unprecedented, horrendous, really difficult things right now. I think we've got a duty to show that we're applying the same sacrifice and the same discipline to our own decisions as we're asking all of you to do in yours. I think I covered all of your question there. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Just returning to this issue of quarantine, you touched in an earlier answer on the practical difficulties around this if you do something different. But if you can't stop people travelling via Newcastle, Manchester, or Heathrow, is there any point? What's the point of doing something, taking a different approach?
Well, it's not that you can't do it, it's more complicated. So if you take the situation right now of the requirement to self-isolate from countries, well, the travel corridors have been suspended, so that now applies to all countries apart from those where there is a stricter travel ban. That applies if you're coming back to, or have been coming back to Scotland from one of these non-exempt countries, flying into Heathrow and then coming to Scotland, you still have to self-isolate when you get here. You're not exempt because you don't travel directly into Scotland. So there are ways that we can impose restrictions that we think are necessary for public health reasons, even with those travel patterns. But clearly, it all becomes, it's not that it's impossible to do it alone. There may be more constraints trying to do it alone, but I think most people can see that it would make more sense and probably be easier if you were doing that on a Four Nations basis, which is what we will try to get to. But I come back to the point I've made before. I'm the First Minister here. My responsibility and accountability is to all of you within the areas I have responsibility for. And I've got to make the decisions I think are right. I can't stand here and tell you that I take really seriously the need to learn lessons and that I'm genuinely sorry, as I am, believe me, for any mistakes or shortcomings in our approach that might have led to the impact of this pandemic being worse. I can't do that if I'm not prepared to actually learn those lessons and do things differently in the future. Dan Vevers from The Sun.
Thank you, First Minister. Good afternoon to you both. It seems that for about 4 or 5 days now, you've been saying the number of care home residents vaccinated is about 95% with the first dose, that is. Is it proving difficult to get those last few done? And may it be some time before you can tell us 100% of first doses are completed? And can you talk us through the complexities there? And secondly, just looking ahead to the happy day you stand here and start saying that we can ease restrictions, will you follow the same route map out of lockdown as you followed last summer, or do you envisage modifications or even a complete overhaul? Are there lessons to be learned, for example, in decisions like the one to reopen pubs and restaurants about 6 weeks before gyms?
No, we'll take the decisions in the order we think is right for the circumstances we're in right now. I think any leader who stood here and said we're just going to do 100% the same as what we did last year, given that we have since suffered a second wave, would not be doing their job properly. So there may be some things that, for obvious reasons, turn out to be broadly the same, but there may be other things that we think, you know what, that was a mistake last time and we're going to do it differently. And while this was a priority last year to get children back to school, perhaps what we understand better now is the other sacrifices that might be required in order to get children back to school and keep them back to school. So there won't necessarily be the same order of things. On your first question, again, I think the answer to this, when we stop and think about it, is probably pretty obvious. I'm not sure. I would love to say that we can, but I'm not sure that in any cohort for vaccination or in the adult population overall, we will ever get to 100% uptake. We want to get as close to that as possible. But unfortunately, there will be some people who decide not to be vaccinated. I really hope that is very, very few people. And if you're in that category thinking it might be you, please think again and get the vaccination. But particularly in care homes, there will be some people, and we hopefully will get a bit above 95%, but where we will reach in terms of 95%, between there and 100%, I'm not sure, because particularly with older people in care homes, you will have people that are very close to the end of their life, whose frailty and other health conditions might mean that vaccination is not something that would be appropriate to do for them if somebody's in the very final stages of their life. And these should be obviously decisions that are not dictated by a politician, but very much taken with clinical advice and in discussion with individuals' families. So I would caution against thinking in any group, but perhaps particularly in care homes, that we will ever reach absolutely 100%. But we're going to do everything we can in every group to get as close to that as it's possible to do.
Yeah, I think there are 3 reasons why you would never get to 100% in that group. It's testament to the hundreds of care home workers and vaccinators to have got to 95% in this pace. Consent, so not everybody takes it. That may be the individual themselves, or it may be those with power of attorney over their care. Pre-existing conditions, there are a few pre-existing conditions where you wouldn't vaccinate, and end-of-life care, very close to end-of-life care, would be one of them. And then safety. So there are some areas in which we're still working with care homes where there's been an outbreak, where it hasn't been the priority to just do the vaccination, where we're still dealing with testing or perhaps infection and prevention control, where health boards have been a little bit slower to go into those care homes for very good reasons. So I think those 3 reasons are why we'll never reach 100%, but 95% is astonishing, frankly.
Michael Blackley from the Daily Mail.
Hello, thank you, good afternoon. You've said on a few occasions that you have 1,100 vaccination sites, which includes 750 GP practices. Could you clarify the position just now in terms of the 350 sites that are not GP practices, how many are actually carrying out vaccinations this week? And how many will be carrying out vaccinations from Monday? And I also understand that it's been made clear to the Scottish Government that the Army stands ready to provide further support on setting up community vaccination centres and helping with the rollout of the vaccine. Why has the Scottish Government not yet taken up this offer?
On the first part of your question, I don't have these detailed figures in front of me right now. All of the vaccination sites will be delivering vaccination. There'll be a whole host of reasons why some on some days might not be operational, but they'll be operational overall. We provide lots of information, but again, there's a level of detail here that I don't bring with me to have at my fingertips. We'll provide that should it be possible, and should it be not disproportionate in terms of the burden that puts on people who are already working really hard. The 1,100 figure, it was what we gave at the start of the vaccination program, or close to the start of the vaccination programme. That will be growing all the time, of course, because more of the, I'll use the term for shorthand, mass vaccination centres. The reason I'm saying that shorthand is because within the category of mass vaccination centres, you'll have quite small scale places in smaller communities, and very soon places like the Edinburgh International Conference Centre, or as has been the case for the last couple of weeks, the NHS Louisa Jordan in Glasgow. And all of them will be working as hard as possible to get the vaccination programme done as quickly as possible, but sustainably as well. And the sustainability of this is, I've described it as a race against the virus. It is a race against the virus, but I was struck by a comment, I think, I'll be corrected on this if I'm attributing it wrongly, I think from Andrew Buis from the BMA GPs last week, reminding us that while it's a race, it's not just a sprint, it's a sort of fast marathon. So we have to make sure we're doing this sustainably as well. I was reading some stuff this morning in the Health Service Journal with supplies in some parts of England being diverted to other parts, which, we're trying to avoid that kind of stop-start in any part of the country. We want to build this up and to do it sustainably. On the Army, firstly, we're very grateful, as we have been throughout the pandemic, for the logistical support that the Army has given us on particular issues at particular times. If we think we need more help and it's help they can provide, we will not hesitate to ask them to do that. But I would also say we're not wanting to put undue burden on the army when we don't think we necessarily need them at every opportunity, or rather at every juncture to do everything. You know, I know the army, I think a few hundred actually, army personnel were called on in, I think, London and another part of England to help deliver sort of frontline care as almost as healthcare assistants. So we know that the army, just like every other part of our emergency response right now, is under a lot of pressure. So we think carefully about where and when we call on them, and we want to make sure that we are, when we're asking them to do things, it's things that we genuinely think we need them to do and where they are adding value. We don't want to kind of almost overuse that, because we have the responsibility to make sure we're doing these things within the health service infrastructure, as in the main we are. So these will always be careful judgments that we make. Simon Johnson from The Telegraph.
First Minister, on the Prime Minister's visit tomorrow, I mean, there have been various points in fairly recent history, not too hard to think of examples where you see leaders going out in the middle of a crisis, basically, and visiting places as a means of reinforcing public confidence to boost morale, that sort of thing. I mean, isn't there an argument that Boris Johnson coming up tomorrow, maybe he's going to a vaccine research centre, I don't know, or see how the vaccine's being rolled out, that there is a justification on that level. On quarantine hotels, you've used the word comprehensive a few times. I just wanted clarification that it means what I think it means, i.e. all countries, regardless of where passengers come from. And lastly, I just wanted to go back to the question I asked you on Monday about the sharp drop-off in vaccinations on the Sunday. You said it could have been due to a time lag, but there's not really been any appreciable increase. Well, there hasn't been any increase in vaccinations in the days since. So I just wondered if that really was the real reason for that sharp drop-off we saw.
I'll take these points in turn if I remember them all. Firstly, Simon, don't take this the wrong way. I'm meaning it partly jocularly, and I will be delighted if I'm proved wrong on what I'm about to say. But I'm going to take a wild guess and say that on the issue of Boris Johnson's visit, the Daily Telegraph is going to take the side of Boris Johnson and not the side of me in the sort of assessment of whether it is essential or not. But if I'm proved wrong on tomorrow's front page, I'll come here and acknowledge it to you in person at the next opportunity. But I'm just, I don't know, there's just something that makes me think I'm probably right. And it comes down to what is essential. Yes, in normal times, we all do these things, and it's right and proper that we do. And that's why I'm trying not to make this purely about Boris Johnson coming to Scotland. I'm trying to illustrate this in terms of the decisions we're all making. And I deliberately use the example of, because he may well be coming to visit some kind of vaccine-related thing. But in Scotland right now, I'm asking myself, is it essential for me to go and visit a vaccine centre or not? Because in the particular circumstances we're living in right now, with an infectious virus, and this is possibly the most important point, when we are telling other people not to travel when it's not really, 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 really essential, then I think we have an obligation to subject ourselves to the same rigour in deciding what is essential and what is not essential. Nice to do. I would love nothing more, and I hope, you know, before too long I get the opportunity to go and visit every major IC unit in the country to personally thank those who have done so much for us. It would not be responsible or essential for me to do that right now, and it would, you know, not be helpful to them. And there's loads of examples I could use of things that I would like to do right now. But in a pandemic, when we're saying don't travel unless it's essential, like to do is not the barometer, it's not the test. Is it really, really essential? That's the test. And I would say me travelling from Edinburgh to Aberdeen to visit a vaccination centre right now is not essential. And Boris Johnson travelling from London to wherever in Scotland he's going to do the same is not essential. And if we're asking other people to abide by that, then I'm sorry, but I do think it probably is incumbent on us to do likewise. I look forward to that being translated into the front page of the Daily Telegraph tomorrow, which I'll even predict what the headline is going to be. Sturgeon says Johnson not welcome in Scotland, which is not what I'm saying, just to be very clear. Quarantine hotels, my definition of the word comprehensive, maybe I'll bring you a dictionary as well for the next time. Yes, my starting point in that would be anybody coming here from overseas. Now, you might work back from that, as we did with self-isolation, and have some exemptions where there is a good case for that. But I think unless you start in the maximalist position and work back from that where there's a genuine case for exemptions, if you don't do that and instead work from the minimalist position, you just leave too many opportunities for the virus to slip through your net and get into the country. On the last point, which is about the weekend figures, there's no suggestion there was a particular data lag, and I didn't say, I definitely thought that, I said it could be. But what we do know week on week is that while you will see daily variations in this, particularly at the weekend, and I think one of the challenges for us is to make sure that we're getting the daily rate up overall, but that we're not seeing a lag in that at the weekends. But if you look at the 7-day figures, we are increasing the vaccination rate. So the week up to the 20th of January, we vaccinated about 117,000 people. In the week up to the 27th of January, that was over 150,000 people. So the programme is accelerating. We have, obviously, all of us got work to do to make sure it is accelerating even further and that we meet those targets we've set, which we are on track to do. Helen McCardle from the Herald.
Good afternoon, First Minister. I just wanted to ask, obviously, in addition to quarantine, self-isolation is massively important, and I think John Swinney did say in his briefing yesterday that you were looking at extending self-isolation support. So I wondered if you had any other details about that. And in relation to self-isolation, will strengthening that also include perhaps having some kind of isolation accommodation for people who need it, and maybe additional things like dog walking or support for people that have got caring responsibilities beyond just financial support or improved financial support?
We will set out, I'm not going to do it today because we haven't finalised the detail of it yet, but we will set out very soon an extension of the support that we're giving for self-isolation. On the last part of your question there, councils, we already gave councils some additional resource. Councils have an outreach service for people who are self-isolating, so they already have been given some resource to provide practical support where somebody says that would be necessary for them, and that could include accommodation. But one of the things we've been looking at is how we make sure that any practical needs people have, from accommodation to shopping to dog walking, if that is what it is, that people are able to access that, and that is being provided. But we're also looking at two additional things. Firstly, the eligibility criteria for the self-isolation payment, the £500 payment that's available right now. That is available to people who are on benefits. We've already extended the eligibility a bit, but we're looking to see whether we can extend that further. And secondly, whether or not we think it would be helpful and whether we can, within the resources we've got, increase the quantum of the payments that are made. So we're thinking through these things just now, and I hope that we'll set out the detail of that in the coming days. Gina Davidson from the Scotsman.
Hi, thanks very much, First Minister. A couple of questions just to go back to travel. You've been very clear about people not booking holidays abroad for this summer, but I was wondering if you thought that holidaying in Scotland would be okay then, because I think people are now trying to start booking up staycations, as they're apparently called. And I wondered if you had any advice for people around that. And also, given the worry about importing COVID from abroad, and I think Professor Leitch has warned already that foreign travel for the rest of the year is probably unlikely. I just wondered how this is impacting your thoughts around COP26 and whether or not you might have to cancel that event again this year.
I think you've just promoted me beyond my existing station. It's not within my gift to cancel COP26. That is a United Nations summit. I very much hope COP26 can go ahead, but clearly, we will, all need to consider the position, but it would not be my decision. Whatever happens, and I very much hope it is able to proceed, the challenge we all have and the obligation we all have to up our game in tackling climate change has not disappeared because of the pandemic. Jason may want to say a word about this as well. So I'm going to, again, deliberately not put dates on this, because it's not fair to anybody watching for me to put dates on this that I don't yet know whether they will turn out to be realistic or not. I'll tell you what I hope. I hope that if we suppress the virus again to very low levels in Scotland, which we know we can do, if we then more effectively than we did last year put protection around the country to guard against importation, and if we, again, as we know we can do because we did it last year when we first suppressed the virus, control outbreaks and clusters through test and protect, as I've just been talking to in response to Helen, do even more to support people self-isolating. I hope that then gives us the ingredients to allow greater ability to have normal, not 100% normal, but more normality domestically within our country. And I hope, but this is the bit I can't tell you exactly when or give you 100% guarantees around, but I hope that would include the possibility of us all being able to support the domestic tourism industry by having maybe breaks elsewhere in Scotland. But there's certain things we have to do to create those conditions. Suppress it through everything we're doing now, stop it coming in, and for government making sure that Test and Protect is working well. If we do all of that, and that does take all of us, then I would hope that staycations in the summer may be something that's possible. But I'm not going to stand here today and say that's definitely going to be the case by X date, and then everybody goes and books their holidays, and for whatever reason, it doesn't turn out like that, and then rightly you'd be blaming me for booking a holiday that you couldn't have. So let's work our way through this next phase with us being as upfront as possible about what is able to happen and when. But if we all do these things I'm talking about right now, we do give ourselves the opportunity to have greater normality within our own borders than we have at the moment. That's the prize. And of course the other big factor in that, which I didn't mention earlier on, is vaccination, which is progressing and is helping us to create those conditions for greater normality.
I was going to add vaccination to your recipe, but you did it right at the end. So I think that recipe is the way to get to an ability to travel around Scotland. I can't tell you when that's going to be. It's certainly not going to be this month, but let's hope that it's in the summer, and that depends on each and every one of us following the rules, the government taking responsibility for some of that infrastructure, the vaccination rollout, the test and protect system, of course, and our advice to gradually open society up in a very, very sustainable but gradual way. And that will mean children first, as you've heard the First Minister say. Very briefly on COP26, you can be assured that public health advice is in the centre of that planning. I and others have been involved in that. It's a UK government-led process, but Scottish public health leaders are in those conversations. And there are plans for everything you can imagine, from, unfortunately, cancellation right up to a full COP26, with everything in between, perhaps just the negotiators, perhaps just a virtual event. But all of that will depend on where the UK is, but more importantly, almost where the rest of the world is, because it takes us to our travel conversation we've been having all lunchtime about where people are coming from, not just where they're arriving.
Good afternoon, First Minister. You've talked in the past about following not just the letter of the law, but the spirit. And you mentioned today about whether or not the Prime Minister and his staff should consider his trip tomorrow to Scotland as essential. I'm wondering if you get your thoughts on one of your own MPs who's moved to a second home 170 miles away from his constituency and has confirmed that he's travelled a few times back to that constituency, which we reported in this morning's Press and Journal and the Courier. I'm just wondering if you get your thoughts on whether or not he should reassess whether or not his travel is essential.
Thanks, Paul. I'm loosely aware of the story. I have to say I don't know all of the details of it yet, but I have asked the whips in our House of Commons Westminster group to provide me with the details of this. I know the MP in question, Kenny McCaskill, has given an account of his travel, but I obviously want to understand the detail of that. So I'm not able to get into any more specifics around that, but what I will say, and this applies to that, to my travel, to Boris Johnson's travel, none of us are exempt from this right now. The practical considerations of the jobs that all of us do will lead to different situations in terms of where we travel to and whether and to what extent we're out of our homes. But we are all subject to these rules. And we all have to make sure that within our own particular circumstances, we are abiding by these rules. And that's true of me, it's true of Boris Johnson, it's true of Kenny McCaskill, it's true of anybody else. The one thing that infuriates people, and I understand, and I felt it a bit myself before Christmas when I had the very, very momentary lapse of not wearing a face covering when I was at a funeral for literally, a very short period of time. I know that nothing infuriates people right now more than thinking there's one rule for the majority and another rule for those in positions of authority. That's not the case. It is not the case, and it shouldn't be the case. We are all living through this pandemic. We are all as capable of getting and transmitting COVID as anybody else, and these rules apply to us as well. And I think that is a comment that I will continue to make and make very strongly, and I don't care if that upsets Boris Johnson or whoever. That has to be what we are all absolutely intent on being the case right now. Mark McLaughlin from The Times.
Afternoon, First Minister. At the end of the first wave, you said, if I knew then what I know now about asymptomatic transmission, I would have done things differently. And we had questions being asked about how much was available at that time. Today, you're saying, if I knew then what I know now about international travel, I would have done things differently. But people like Davy Street, Linda Bald were all saying you need to protect your borders way back at the end of the first wave. So I don't think you could say that you didn't know that travel was such a risk last summer. So it seems like a political decision not to take that rather than a decision of perhaps ignorance like the asymptomatic thing. And what's your comment on that?
The decisions are mine, and I take responsibility for them. And I do think you're right that there are some things like the nature of asymptomatic transmission that was an underdeveloped part of our scientific understanding from other things, and travel may be part of those other things that are more policy decisions. But I take responsibility for every aspect of how the Scottish Government has handled this, and with some of those other things, and again, this is not me trying to evade responsibility. I am not and never have tried to do that. But as I've been reflecting on here today, whether it's travel, international travel, or timing of lockdown and economic support, the Scottish Government has got big responsibilities, but some of these issues, there are interdependencies with decisions that other governments across the UK take as well. So, these are just the things that we perhaps came to a different judgment on back then. Would it be practical to have, and obviously given some legal issues around border force, would it be practical to have standalone Scottish travel restrictions? It doesn't invalidate the reasons for the judgments back then to say that with hindsight, I think they maybe weren't the right balance of judgments and that we would do something different right now. I don't know. Look, I could stand here and just do that politician thing and say, do you know what, we didn't get anything wrong and we've just been really unlucky, and I'm not going to admit any failings. And that wouldn't sit easily with me in these circumstances, and I don't think it's what anybody wants to hear. What I do know, absolutely know, is that every single day I and everybody I've worked with in the Scottish Government has tried to do everything we can in the best way that we can. So our motivation, our effort, our determination, I would defend to the last. But I can't look at the figures. And Scotland's death figures proportionately are lower than the UK's overall, but they are still too high. And I can't look at them and say that every day we succeeded in doing everything possible. And I'm just trying to be frank about that. Now, in terms of what we could have done differently, in some respects, that's for other people to judge. You know, it's not for us to mark our own homework. All I can do is give you my honest appraisal of what I think and what I agonise over. You know, sometimes in the wee small hours of the night, but literally every day, the things I agonise over and think, if only I could turn the clock back, here's what I would like to have the chance to do differently. I can't turn the clock back. I wish I could in many respects, but I can't. But what I can do is try not to repeat mistakes of the past. And that's, again, you know, maybe I'll not succeed in all of that either, but I can try. And borders is one of the issues where I think if I could turn the clock back, I would do things differently. I can't, but I can make sure we try to do it better in future. So there you go. That's just the way I prefer to approach this. It's maybe not the traditional politician way of doing things. And yeah, you can rightly and properly, you know, pick through the weeds of, well, is this down to lack of knowledge or is it down to bad judgment? You know, and you know what? Across the piece, all of these things, in some respects, will be true. But I've tried every day to do the best, and part of trying to do the best every day from now on involves being open and candid about things we didn't get right and trying harder to get them right in future. Jason, do you want to say anything about... I won't ask you to list your mistakes, and because you haven't made any. The mistakes are mine. My responsibility is mine.
Enough time for me to list my mistakes. I think that today it does feel like a day for reflection. I watched the press conference last night with Chris and the Prime Minister and others, and 100,000 deaths across the country does feel like a moment, and I thought the First Minister represented it well at the beginning of our briefing. So it does feel like a time for the public health advisors to step back and think, has our advice been appropriate? But much more important than that, what is our advice now? And you've heard us try and articulate that a little over the last few weeks and today around cross-border travel, around vaccination, around what testing should be, and a slow but sustainable return to normality. And the price we're asking people to pay just now, unfortunately, is so high, both in the past and immediate, because we're asking you to still stay at home for now. So I think today does feel like a day of reflection for both of us. We were talking about it upstairs. It feels like a difficult day, but there is light at the end of the tunnel. There is hope, and vaccination and other elements of this pandemic will come to an end, I promise you.
Final point for me on this, which is about being very clear where responsibility lies. One of the things I've been very fortunate in is the quality of advice I have had. If I think initially Catherine Calderwood, then Gregor Smith as Chief Medical Officers, Jason as National Clinical Director, Fiona McQueen as Chief Nursing Officer, and their respective deputies, everybody who's worked in the Scottish Government advising me and my ministers, and supplemented with genuinely world-class advice from the likes of Professor Davy Schridder, Linda Bald, people like Steve Riker, Andrew Morris, genuinely the best advice any First Minister could have hoped for. And the job of decision makers is to take all of that advice and make the decisions. And the reason I'm here and the reason you elect me and pay me to be First Minister is because ultimately the responsibility, if we get these things wrong and I don't act on that advice properly or I make the wrong judgments on the basis of that advice, that's on me and ministers. That's the very nature of accountability. And, we try to get these things right and we try to learn from mistakes, and we will keep doing this. Never been a time that it's been more important to do that than now. In some respects, it puts everything else that I have dealt with in my time as a politician, anything else I might be dealing with right now, puts all of that into perspective. This is the most important thing every day right now, to try as hard as we can to get right. And that, as Jason said, I'm always aware of that. But right now, at this particular milestone in this pandemic, I think it is a good moment to remind ourselves of what we've lost, reflect on that, and just redouble our efforts and determination to steer this country as safely as we can through the remainder of this crisis. And thank you for the part all of you play in this as well, because we couldn't have achieved the things we have achieved in terms of suppressing it last year, starting to suppress it again just now, without the sacrifice of everybody across the country. So on this particularly sad day, given the milestone we've been reflecting on today, thank you to everybody for everything you're doing. I'm grateful today, as always, to Rachel for her BSL interpretation, to Jason for helping me answer the questions, and for all his advice, to all of the journalists and to all of you. Please, for now, keep doing the things that we know are making a difference. Stay at home, help us protect the NHS and save lives. Keep doing that, and we will get through this, and the vaccination programme will help us to do that. I will join you tomorrow from the Scottish Parliament, where I'll give the daily update and then take the weekly session of First Minister's questions. And the Health Secretary, I think is the plan at the moment, will be back here on Friday for the daily update at 12:15. But in the meantime, thanks for joining us today.